Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations. And today, like usual, we have a guest today to talk about the stuff we do in public health that is not COVID. You know, you think over the last 2 years, that's mostly what we've been doing, but we've been doing a lot else. And we're joined today by Gabriela Goldfarb, who's the Oregon Health Authority Environmental Public Health Manager. And she is the spokesperson this year to help us with fires and smoke. So we'll start with COVID and then we'll get to Gabriela and talk about that. So for COVID, things are pretty stable. We're still seeing a fair number of cases in the US, in Oregon and in Douglas County at about 30 to 40 cases per 100,000 per day. Now we know there are probably a lot more cases because people are testing at home. And when they test at home, they may not report their positive results. So we think there still may be more cases than this. But the good news is that the number is not really increasing. The number's been pretty stable over the last 3 or 4 weeks. And we're also seeing not very many hospitalizations. So we've generally had less than 10 hospitalizations a day from COVID. And thank goodness, we're not seeing very many ICU admissions. We're not seeing very many people on ventilators. And we are still seeing some deaths, but certainly down from what we saw before. What we are seeing is that the vaccines seem to be really quite effective. When we look at our deaths, they're almost all in people who are not vaccinated or not up to date. And so we know that the vaccines are really helping people to protect against the most severe consequences of COVID, that is hospitalization and death. For adults, the vaccines are plentiful and widely available. So if you have not been vaccinated, please go ahead and get vaccinated. If you're vaccinated but not boosted, please get boosted. And if you're in the age group like I am for a second booster, please go ahead and get your second booster. There's been a lot of news this week about vaccines. And so over the last several weeks, we've had several new vaccines approved. One of these is a vaccine made by the Novavax, and a company that makes one called Novavax. Novavax is a protein-based vaccine. So what they do is they figure out the spike protein from the COVID germ, and then they produce that protein and put this into a vaccine. This is pretty much how vaccines have been made in the past, and is slow. So although they've been working on it since the very beginning, it's now 2 and a bit years out before they've been able to produce this vaccine. So because it's slow, it's much slower than the RNA vaccines. But for people who've been worried about the RNA technology or whatever, Novavax may be a good option for you. The bad news is it gets produced slowly, so there's not very much available. But when it does become available, this would be a good option for people who want to get vaccinated but are worried about the RNA technology. The other news that happened in this last week was Moderna got a vaccine approved for kids 6 to 17 years. We already have another vaccine for kids at that age group in the Pfizer vaccine, so I don't think that's going to make a big difference. But the big news is approval of 2 vaccines for kids 6 months to 5 years of age, and that is Pfizer has a vaccine and Moderna has a vaccine. Both got unanimously approved last week and started shipping on Monday. We got our supply on Monday and have delivered to clinics all over southwestern Oregon yesterday. So clinics should be able to start doing that soon. I know the Cow Creek tribe is doing an event this weekend where they're going to be doing vaccines for all ages 6 months and above. So we are certainly recommending it for kids 6 months to 4 years. So for people who don't watch all the time, I'm a pediatrician, so I deal with this on a regular basis. And the question is, why would you vaccinate kids at that age? Because they tend not to get very sick from COVID. Well, there are a couple of reasons. One is, well, if they don't get very sick from COVID, they can get it and pass it on to their family. And there are good studies that show that when kids get it either daycare or at school and then bring it home, they're really very, very efficient spreaders at the household. Not surprisingly, right? You're holding them close, you're wiping their nose, they're coughing in your face. And so not shocking that they should spread it to others. And so we do want to get the babies vaccinated so that they won't be passing on to the parents, or more importantly, to the grandparents. Grandparents are really important. Pass it on to their grandparents who might be at risk from getting severe disease. The second reason we do it is that although little kids don't get a lot of severe acute disease, we're seeing a lot of long COVID in kids. So almost every day that I'm in clinic, I see one or two or more kids who have long COVID. That is, they got COVID and were maybe not that sick during the COVID, but then a month or two later, they come down with it. They're just miserable. And in the younger kids, we see a lot of sleepiness and crankiness. And so the parents came in and say they had COVID, they got over that, but boy, they just are like sleeping beauty. They're sleeping 20 hours a day, or they're so cranky. And we look for all kinds of other things and don't find it. We think it's probably due to the COVID. In the older kids, we're seeing a lot of persistent chest pain, a lot of shortness of breath, a lot of difficulty breathing, and a lot of decreased exercise tolerance. And so just saw a girl in the office yesterday who, an active kid, cheerleader, and when she had COVID, she wasn't very sick. The rest of her family was sick. But then afterwards, she was just feeling this chest tightness and her heart racing and whatever. Did a big workup and it was all negative. But it's taken her a while to recover, and she has. So the long COVID stuff does get better, but it's kind of nasty. The last reason is this multi-inflammatory system in children, or MIS-C, which is this funny thing that happens after get a mild infection. A few weeks to months later, kids wind up with this intense inflammatory response where they have high fevers, they can have liver disease, kidney disease. Many of them wind up in the ICU, and some have died. And so this has been a big concern. We don't see it at all with the vaccine. So we think the MIS-C could be prevented with the vaccine. So again, those are all the reasons to go ahead and do the vaccine. The vaccine seems to be really very safe, pretty effective. What happens is these new variants are good at escaping and changing. So it's a little less effective than the original, but still 50 to 80% effective in preventing disease. So we're recommending it. There's a little bit of difference between the Pfizer and the Moderna. Moderna's 2 doses, Pfizer's 3 doses. Pfizer's a little more effective than Moderna, but they're all pretty much the same. So we are encouraging kids now 6 months to up to age 5 to go ahead and get their vaccine. The other things that people ask is what's going to happen in the future, Bob? And my answer is I'm really not good at predicting even things that are happening today, but I'm really terrible about predicting things that are going to happen a month or 2 or 3 from now. But there's a couple of ways we do predict. One of the things we look at is we look at the level of disease in the United Kingdom. All throughout the pandemic, they had disease 6 to 8 weeks before we did. So the initial surge, the alpha surge, the delta surge, the Omicron surge, they had all of those about 6 to 8 weeks before we had them here in Douglas County. And so by looking at what they're doing, we can sort of predict what's going to happen in the next 6 or 8 weeks. The good news is they're having a very low COVID summer. And with their low COVID summer, we would predict we're going to have a low COVID late summer. What's going to happen after that, a little hard to predict. This virus is now in so many different animal populations, not only in humans, but in cats, in mink, in rodents, in deer. And so it's in a lot of different populations, and it can spread in those populations, pick up new mutations, and then come back to the human population. So we think the Omicron variant started in the human population, then spread to the rodent population in Africa, then spread back to people, and then spread throughout the world. That is totally unpredictable, right? Because we can't predict what's going to happen in animal populations. So we could still wind up with another nasty variant along the way, but at least in the moderate term, in the 6 or 8 week term, I would expect that our current number of cases is going to slowly fall over the next few weeks, and that we're going to have a pretty good summer. Come the fall, there is some talk that there's going to be a new booster vaccine that has both the original strain plus the Omicron strain in it, which should give people better protection against Omicron. Of course, we don't know if there are other variants, so we don't know if there's going to be protection there. But it looks like the summer, at least from COVID, is going to be quiet. But I can almost certainly predict that it's not going to be quiet from the fire season. And that's why we've invited Gabriela here today. So thanks for joining us.
I'm really happy to be here. And now is good timing for people to get ready for wildfire season. So appreciate that we're talking about this today.
So what are the predictions, given the fact that predictions are really hard to make? What are the predictions for the fire season this summer?
We've all been encouraged, at least fire-wise, maybe not so great camping and picnic-wise, by the cool, wet spring. But we can't have kind of a false sense of security because of that. As we are seeing this weekend, we're going to have very hot temperatures. All the lush green grasses can turn to tinder pretty quickly. So we can't predict what the heat is going to be like, but I know our fire marshal, Department of Forestry, are seeing higher fire risk for this summer, and so we need to really prepare now our families to be ready to be resilient and make plans, particularly our most sensitive populations, to take steps to be ready.
And while it may certainly be a little cooler here, it certainly was not cool in the East. I was in Chicago and then Virginia last week, and had 3 days that were over 100 degrees. It was blisteringly hot back there, and that we could certainly get that again. So if you're going to ask people to get prepared, what should they do to be prepared?
So there's a lot of information, a lot of ways. One is to make a plan, particularly if you are especially sensitive to smoke. People who have cardiovascular, heart, elevated stroke risk, respiratory, breathing, lung issues. Make a plan to how you're going to, if possible, leave the area if there's smoke. Or if not, make a clean air space in your house. And we have resources on the Oregon Health Authority website. If you do a search for Oregon Health Authority and wildfires, you'll find a lot of resources there. So that's one thing. When there is fire happening and we do have smoke in our communities, there are a couple ways that you can track, where the smoke is and if it's coming your way. There's actually an app for smartphone users, if people are inclined and savvy that way, called Oregon Air, that the Department of Environmental Quality put together. And you can look up the closest air monitor to where you live and what the air quality is. Also, if you're planning to travel, you can see where in the state air quality is compromised because of poor air quality. They cover all kinds of poor air quality, but we're all most interested when there's wildfire smoke. There's also a website that a bunch of agencies have gotten together. If you do a search for Oregon Smoke Blogspot, I don't know why it has that name, you'll find a site that has all kinds of fire and smoke information for you. So so being informed and making preparations ahead of time. I'll delve, if I can, a little bit into making those preparations. That's all about creating some type of cleaner air space in your home if you can't get away to family, usually on the coast or someplace like that. And so I know that you just made a video about a DIY box fan filter that should be in reach of everybody. You can watch Dr. Bob put it together himself. It's on the YouTube channel and I think on Facebook. And that's a great option. But you have to think ahead to get a box fan and to buy filters. They're rated, and I think all that information is on there in terms of what kind of filter to get. But you want to do that before the smoke starts and before the store shelves empty out from those filters. And we're talking about the kind of filters that you put into your HVAC, furnace. So it's just that standard type of filter, and you stick it on a box fan, and it will pull in smoky air in the room, and get all the smoke particles out, and make sure that you have at least one room in your house where you can breathe cleaner air. The other thing, and we'll be getting this information out, the agencies will be doing that. Our Oregon legislature took a lot of actions to set up cleaner air spaces in communities where there's high wildfire risk. So our partners over at the Department of Human Services are giving out grants to local governments and tribes to help make their public spaces, so think libraries, community centers, cleaner air spaces that also are refuges from smoke, because a lot of times when we have smoke and fire, we also have high heat, and we all know from what we experienced a year ago that heat can be very dangerous for health. So those are a few of the steps.
Great. Well, thanks for that. Yeah, we did make this video yesterday. It's on our YouTube channel and our Facebook page, and it was me making this thing. And then I set a little fire in my garage, and then used this smoke fan, and it really cleared it out incredibly quickly. It worked so much better even than I anticipated. So getting those things, the MERV 13 filters and the box fans ready now would be a great thing. We're also going to try and store some here to have them ready should we need those. The other thing I would point out with this, again, being a pediatrician, we see babies, and babies breathe a lot faster than we do. So, we as adults are breathing 12 or 18 times a minute. Babies are breathing normally 12 to 20 to 40 times a minute. And their tidal volume, that is the amount they take in for breath, is higher for body weight than adults. So that when smoke is there, they breathe in a lot more smoke than you or I would. So in addition to the conditions that Gabriela mentioned, both extremes of age, both really young kids and both really old people, seem to struggle much more with smoke, and we want to get them protected. In addition, smoking cigarettes is also a bother because that you obviously then are generating a lot more smoke that way. So you also mentioned heat, and one of the things that we're also telling people with heat is that in Oregon, when we have high heat, we generally have low humidity. Unlike Virginia, where, oh my God, it was 100 degrees and like 80% humidity. It was miserable. So a fan didn't help very much. But in Oregon, water and fans really do help. So blowing air around and wetting yourself with a washcloth or whatever really can help bring down your temperature. So the Oregon Air, how do people get that app?
So if you have a smartphone, you just go to the App Store for your phone, whether that's Android or iPhone, Apple, and just type in Oregon Air. And so long as it says DEQ, you'll be able to download that app, and it comes up with a little map of the state, and you can those of you who have phones know how to zoom in on a particular part of the state, and that will tell you, it's a red, yellow, or green, yellow, orange, red system, which is the system that is tied to something called the Air Quality Index, and it's something that was set up by the Environmental Protection Agency to help communicate what the air is. So green, you're good to go. Yellow is moderate air quality concerns. People who are particularly sensitive may feel it. Orange, you're going to have more and more people who are feeling the effects of poor air quality. And of course, it just gets worse from there.
And for those of us who are not as sophisticated, we said, well, if you can see the Callahans, which are about 10 miles away, the air is clear. If you can't see the mountain ranges across the freeway, it's dirty. So, you can use your eyes too to see what's happening there. And it correlates pretty well. We check Oregon Air every day, even on good days, and then check it every hour when there's smoke around. And it's been really, really quite accurate in terms of what's happening with fire and smoke. So what can people do to help prevent these forest fires from starting in the first place?
Well, we have, one thing is to certainly follow once the Department of Forestry declares fire season and restricts open burning. The majority of wildfires in the state are human caused. And so I think people just following fire safety requirements, following the rules, when they're put in place, when high risk is declared, that's one of the biggest things to prevent these kinds of exposures, smoke exposures. And I just wanted to touch on a connection to your opening update on COVID. Early on in the pandemic, I had people, toxicologists on my team research, and there's a very clear link that, especially for people who are not vaccinated, that any exposure to smoke, it both can intensify any pre-existing conditions you have, of course, but also intensify COVID if you have it. It also can increase your risk of getting COVID. And so this is another reason, as Dr. Bob was saying, get vaccinated if you haven't, get boosted if you have. But also, for those of you who haven't, you just need to be aware that smoke is yet another risk factor that elevates the harm from COVID.
So we're going to hope against hope that we're not having a big fire season, but really we're asking people to be very cautious. When we've looked at the big fires in Douglas County over the years, they've come from untended campfires. And so untended campfires are real risks. So we tell you, if you make a campfire, it's not out until it's cool enough for you to touch it. So if you cannot, if it's still too hot to touch, it's too hot to leave. And so you could be really careful there. We had a big fire a few years ago from somebody who was mowing dry grass late in the day, and a spark from that mowing caused a fire. A few years ago, we had somebody had a dragging chain on their car and caused a series of fires up and down the freeway as the sparks from the dragging chain lit that tender, dry grass on the sides of the road. And then we've had some fires from burns that have gotten out of control. So all things to pay attention to, because the best way to deal with this is to prevent it. But if it does occur, I'd really encourage you to think about this smoke-free room that you could move to, and you can get an air purifier, or you can make one by looking at the video that we did yesterday. Well, great, Gabriela. Thank you for joining us. Do you have any final comments?
No, act now before the smoke comes. To go search online, Oregon Health Authority, wildfires, and you'll find a wealth of information there to get you ready for wildfire season and keep you safe. And just thanks for this opportunity to talk with folks in Douglas County. Really appreciate it.
Well, great. Well, thank you for joining us. We'll do this again next week. I don't know what our guest is going to be. We'll have a guest again next week. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Thanks.